When a patient comes in and they have a new kind of cancer diagnosis, I think that there's so much that's going on at that point. I think people are thinking about, unfortunately, I think they're often thinking about, their own kind of mortality in a way. And they're thinking about what's going to happen with their family and, are they going to need to go through treatment with, either radiation or chemo or surgery, or what's it going to be like? And just getting to sit down with them at that initial visit and kind of walk through, what the next month looks like, what the next 6 months look like, what the next 2 years, 5 years look like is really a satisfying experience. And it takes time, but I feel like you can often just feel people's kind of anxiety with things kind of melting away during that initial visit. And then, of course, seeing people, post-operatively who have had a good outcome and are doing well and back to living their lives and doing the things that they love doing and spending time with their families and stuff like that. That's incredibly satisfying as well. One of the earliest patients that I saw here, came in, we pretty quickly picked up on the fact that he had an elevated PSA level, which is a blood marker that we use to screen for prostate cancer. And we were pretty quickly able to get him in for a specialized ultrasound diagnosis for his prostate and a concomitant biopsy that ended up diagnosing him with prostate cancer. And then I got to, again, work through that kind of prostate cancer diagnosis with him and, talk to him about what his options were and really get to kind of understand his priorities for his life and what he wanted to do for treatment in that way. And he ended up electing to have surgery to remove his prostate, went through that process with him. And he did, really well post-operatively. And now I've had, kind of the joy of getting him to see him back over the last now 18 months, after surgery and see how he's progressed and see how his life has gone on and how he's done in terms of, things like urinary and sexual function, which when he came in with his initial cancer diagnosis, he was so focused on the cancer and he wasn't thinking about, those other things. But seeing how he's done in that regard has been really gratifying. I started my residency in 2012. And I already kind of feel a little bit like a dinosaur. The fields have changed so much. We have, just in prostate cancer, we have new forms of PET imaging that we're using. We have new genomic tests. We have new treatments. All of this is stuff that's come out since my residency. And so, the field is evolving and it evolves quite literally on a monthly basis. And I think one of the things that you get when you are kind of teamed up with a world-class research institution like WashU is that you have to be on the cutting edge. You're just, in this environment where where the cutting edge is kind of being defined. And so just, being in and around that, I think means that you're, you have to kind of be up to date on what's going on, what the newest evidence is, what the newest options are. We have to have kind of the best and newest clinical trials going on and offer that for our patients. The most rewarding part is being able to sit down with someone and tell them that you at least think that you've gotten them cured of their cancer. That's an amazing feeling.